Hi, my name is Anna Stone, and today is February 23rd, 2025. And this is my presentation assignment for the class titled Introduction to Assessment. It's taught by Dr. Casey Baker at the University of Wisconsin-Superior in the Department of Education. And I have chosen to present the assessment in counseling called the Geriatric Depression Scale. And its acronym is GDS. So, an overview of this presentation, I will discuss the historical perspectives on assessment and testing and counseling. I will explore ethical and culturally relevant strategies in assessment. I will highlight the Geriatric Depression Scale as an assessment tool, and I will analyze the strengths, limitations, and potential biases of the GDS. So, historically, assessment and testing have long been integral components of the counseling profession, evolving significantly. The emphasis on psychological assessment began in the early 20th century, primarily driven by advancements in psychometrics and the need for standardized measures of intelligence and personality. Psychologists such as Alfred Binet and Louis Terman developed tests to assess cognitive abilities, laying the groundwork for future assessments in counseling. Over the decades, the focus expanded to include various dimensions of human behavior, including emotional and social functioning. Integrating assessment tools into counseling practice has facilitated a more comprehensive understanding of clients' needs, guiding treatment interventions, and measuring therapeutic outcomes. Ethical and culturally relevant strategies in assessment. In contemporary counseling, it is crucial to implement ethical and culturally relevant strategies in assessment to ensure fairness and accuracy. Counselors must be aware of the cultural contexts in which assessments are administered, as cultural biases can significantly affect test outcomes. Ethical considerations include informed consent, confidentiality, and the appropriate use of assessment tools. Counselors should strive to select validated assessments for their populations and consider alternative assessment methods, such as interviews and observations, to capture a holistic view of the client. Additionally, ongoing professional development is essential for counselors to stay informed about cultural competence and the implications of cultural diversity in assessment practices. The Geriatric Depression Scale is a widely used screening tool explicitly designed to assess depression in older adults. Developed by Yasavage and his colleagues at Stanford University, the GDS comprises a series of simple questions that evaluate depressive symptoms and help distinguish between normal aging and clinical depression. It's a straightforward format and focus on the unique experiences of older adults, and it's a valuable resource for counselors working with the geriatric populations. The GDS has been instrumental in identifying depression in older adults, facilitating timely interventions, and improving overall mental health outcomes. The GDS has several strengths that contribute to its widespread use in counseling. Its user-friendly design allows easy administration and scoring, making it accessible for clients and practitioners. The scale is also effective in identifying depressive symptoms, which can lead to appropriate referrals and treatment options. However, the GDS is not without limitations. One significant concern is that it may not capture the full spectrum of depressive symptoms, particularly in individuals with atypical presentations of depression. Additionally, cultural biases can influence the interpretation of responses, as the scale may not account for cultural variations in expressing emotional distress. Counselors must be mindful of these limitations and consider supplemental assessment methods to evaluate their clients' mental health comprehensively. Understanding the historical context of assessment and counseling, employing ethical and cultural relevant strategies, and utilizing tools like the GDS are essential components of effective counseling practice. By recognizing the strengths and limitations of assessment tools, counselors can enhance their ability to support diverse client populations and promote optimal mental health outcome. The assessment practice has deep roots traced back to ancient civilizations, where focus was primarily on identifying individual differences among people. In societies such as those in ancient Egypt, Greece, and China, various assessment forms were used to evaluate individual capabilities, skills, and social status. For instance, the Chinese civil service exams, established as early as 2020 CE, aim to identify qualified candidates for government positions based on their knowledge and abilities. These early assessment forms laid the groundwork for future developments in measuring human behavior and cognitive skills. The formal development of psychological testing began in the late 19th century, primarily driven by pioneers such as Sir Francis Galton and Alfred Binet. Sir Francis Galton, often regarded as the father of psychometrics, introduced the idea of measuring intelligence through scientific methods. His work emphasized the importance of individual differences and the use of statistical techniques to analyze these differences. Following Galton, Alfred Binet developed the first practical intelligence test in the early 20th century, the Binet-Simon scale. This test was designed to identify children who required educational support, marking a significant advancement in applying assessment in academic settings. The 20th century witnessed significant developments in the assessment field, particularly with the rise of standardized testing in education and psychology. The establishment of intelligence tests, personality assessments, and diagnostic tools became increasingly prevalent during this time. The Stanford-Binet Intelligence Scale, a revision of Binet's original work by Lewis Terman, became one of the most widely used intelligence tests, setting a standard for measuring cognitive ability. As psychology evolved, integrating assessment into counseling practices became a focal point, emphasizing the importance of understanding client needs. Counselors began utilizing various assessment tools to gain insights into clients' emotional, social, and cognitive functioning. This shift marked a transition from purely diagnostic assessments to more holistic approaches, considering the unique experiences and contexts of individuals seeking counseling. Moreover, the development of personality assessments, such as the Minnesota Multiphasic Personality Inventory, allowed counselors to evaluate clients' personality traits and psychopathology, further enhancing therapeutic process. These assessments provided counselors with valuable information to guide treatment planning and interventions, ensuring that client care was evidence-based and tailored to individuals' needs. In summary, the historical perspectives on assessment reveal a rich evolution from ancient practices aimed at identifying individual differences to the sophisticated psychological testing methods of the 20th century. This progression underscores the increasing recognition of the importance of assessment in understanding human behavior and guiding effective counseling interventions. Assessment is a systematic process of collecting and analyzing information about individuals to inform decision making. Its purpose is to identify strengths and weaknesses, inform treatment planning, measure progress and outcomes, and understand client needs and motivations. The importance of ethical considerations. We should respect for client autonomy and confidentiality. Non-maleficence, have no harm intended with, or no harm. We do not want to come at this in a harmful manner. We want to help. Beneficence, promote the healing and the well-being of the client, and practice justice, fair and equitable treatment. Some culturally relevant strategies would be to choose assessments that are validated for specific populations, consider language, cultural context, and relevance to the client's background. And when administering assessments, you should ensure a comfortable environment for clients, and use interpreters if necessary to avoid miscommunication. When interpreting results, we must be cautious of overgeneralizing results based on non-normative data, and engage in collaborative interpretation with clients to ensure understanding and relevance. So the person who developed the GDS his name was Yasavage, and he developed this with his colleagues at Stanford University in 1982 to screen for depression in older adults. It's a self-report instrument explicitly designed for older people, and its purpose is to identify the presence and severity of depressive symptoms in older adults. So here is a structure of the GDS. It comes in a short format and a longer format. The short format is reduced to 15 questions, and the long format has 30. And it's yes or no questions that are focusing on emotional and cognitive symptoms rather than somatic complaints. Administration can be self-administered or administered by a clinician. The strengths of the GDS, it's fairly reliable and it's valid. It has a high number of consistency, and when it's validated against other depression measures, such as the HRS-D, which is the Hamilton Rating Scale for Depression, and the SDS, which is the Self-Rating Depression Scale. The practicality is it's brief to administer, and also it's suitable for various settings such as hospitals, nursing homes, and outpatient clinics. As far as cultural adaptability goes, it's available in multiple languages and adapted for different cultural contexts. The limitations of the GDS. It's less effective with individuals with moderate to severe dementia, and that's because they might struggle with recall. The other limitation is bias and fairness. The yes-no format may oversimplify complex emotional states, potentially leading to misinterpretation. The potential for bias and fairness, the cultural bias. The interpretation of questions may vary across cultures, affecting responses, and a lack of inclusiveness in item content it could alienate certain groups. Social desirability. Respondents may answer in ways that they perceive as socially acceptable, skewing the results. And the clinical implications of the GDS. Its use is a screening tool for early identification of depression in older adults, and it supports comprehensive diagnostic assessments. The monitoring progress, it can be used repeatedly to track changes in depressive symptoms over time. And complementary assessments should be used alongside this assessment, and also interviews to better understand the client. The future directions for research would be improving sensitivity. There needs to be further studies to enhance GDS effectiveness with diverse populations, including those with dementia. The cross-cultural validity. Research on translations in adaptations of the GDS to ensure accuracy and relevance in various cultural contexts should be performed. And longitudinal studies should be done to investigate the GDS's ability to track changes in depression across treatment intervention. In conclusion, the GDS is a valuable tool for assessing depression in older adults. Ethical and culturally relevant practices are essential in assessment, and ongoing research is needed to ensure the GDS remains effective and inclusive. And here are my references that I used to prepare this presentation. And thank you so much for watching this and your time.